Good afternoon, everyone. Center of Excellence at School of Tropical Medicine, Kolkata, welcomes all the participants for today's RDLS session. Today's topic is counseling serodiscordant couples, and the speaker is Dr. Nivedita Dutta. Dr. Nivedita Dutta, ma'am, is currently working as a clinical research fellow at the Center of Excellence in HIV Care at the School of Tropical Medicine, Kolkata. A prior association with the center includes working in a clinical leadership role. She is actively involved in various HIV related research projects and has attended conferences and published articles in international journals in the relevant field. We welcome you, ma'am, for today's session and request you to start the session.
Thank you, Sweta, for the kind introduction. My topic of discussion today is counseling serodiscordant couples. As we all know, we have numerous patients at our centers, and we frequently encounter cases where we have young couples who are serodiscordant, and a special counseling has to be done for them because they have lots of issues. And in my following slides, I will be talking about all this. Now, the session objectives are by the end of this session, hopefully, we will be able to explain the importance of counseling to serodiscordant couples, demonstrate the strategies required for working with the couples during counseling sessions, assess and counsel for reducing the risk of seroconversion among discordant couples, guide for fertility planning to serodiscordant couples, and use couple counseling techniques with serodiscordant couples. Today, I was more eager to loop in all the counselors working at the ART centers because frequently the patients who are serodiscordant, the first point of contact with them, with the ART center staff, is at the counselor level. And if my client or my patient is a young man or a young woman who has married recently, or probably he has married, he has a serodiscordant, that is, one is negative and one is seropositive. In these cases, it is very important that a correct knowledge is imparted to the patient, correct counseling has been done. Often, still to this day, it's very sad to hear that there are counselings being done that if you are positive and your wife is negative, better not plan for a baby. So, these are things that cannot be done. We really have to understand we have proceeded a long way from the days the ART was started, from the HIV. Like we have moved a long way with HIV in India today, and the drugs are very very efficient drugs, highly efficacious drugs, and a person, if he is on ART properly, then he will have a healthy family life, a healthy spouse, healthy children, and this knowledge has to be shared with the patient. It's very important because often in the ART center crowd, we miss counseling these patients, and they are left with the agony of being single, sometimes being married with an unhappy life, and sometimes they move into a family life not even knowing what are the precautions and what are the things have to be done. Now, basically, a scenario I will be talking about is a young couple in their early 20s, newly married, came to the ICTC. The girl was advised to get tested for HIV before surgery. She tested positive. This was a shocking news to both of them. Their marriage was a love marriage based on trust. Now, the story is that during the counseling session, the counselor learned that the girl had only one partner to date, that is her husband. So, in most of the cases, when we see that a single member of of the family is positive, either the husband or the wife, sometimes we are judgmental at the level of the ART centers. We take it for granted that he or she has multiple partners, but unlikely that in this case, the girl, she had only one partner, that is her present husband. Now, later on, the husband was tested for HIV and he was found negative. Now, here comes the catch in the story. Another informant was the girl's mother. She is reported to the counselor that she is HIV positive and she is on ART. She was tested for HIV during pregnancy. She had delivered at a private nursing home at her native place. When she delivered, the child was not given nevirapine and child's HIV test was also never done. This is the history being given by the mother, that her mother was positive. She knew her status, but she never tested the child. Neither was the child given post-exposure prophylaxis, like what we give to our children for a properly not treated mother. Now the girl was put on ART at the center level. The couple used to come regularly for counseling. However, there was a rift in the relationship. The girl's in laws were not ready to accept her. At the same time, the girl was not happy with her mother, and all this was affecting her treatment adherence. Now, basically, what are the issues that are cropping up here? Uh, there is the issue that this girl was married. She's a young girl, newly married. She has a husband who is negative, and the gist of the story is her transmission is a vertical transmission, and that needs to be emphasized more because there will be an issue of mistrust between the husband and the wife. And now the girl, she has to be put on ART, but her ART intake will be hampered by her psychological status. When if she is not supported well by her husband, if her husband does not trust her or doesn't confide in her, there will be issues in her marriage, and that may eventually lead to disruption of ART intake. So, what are the key issues in this case? The relationship issues, as I told, is a couple and the family. There's a big query with the trust issue. See, what happens is whenever the one of the spouses is positive and the report has been received suddenly, it's like a shock to the family. And what happens is they usually one of the partners start um, having trust issues, like he or she keeps thinking maybe there was a girlfriend or a premarital sexual exposure which was not disclosed with me. So the couple issues are current and the future. Sexual intimacy is usually hampered. Negative partner. We need to keep our negative partner negative, and family planning is also important. Stigma and discrimination is very important. The patient has to be like the knowledge about HIV, the knowledge of the routes where transmission can occur, and a very good knowledge of the routes where transmission cannot occur. This is very, very important, and ART adherence is also a key issue in this case. Now, basic is enables couple counseling has to be done, which enables both partners to work jointly on their issues so that they may come to a consensus for their own well-being and strengthen the relationship. Now, the couple counseling here is a very sensitive issue because one of the spouses, the husband in this case study, is has come to know that my wife is positive. This positive status is a shock to both the husband and wife, but there is a trust issue with the husband because now he keeps on wondering whether this transmission of HIV to his wife has been premarital or it has been some other sort of relationship that the girl was engaged in, which he was basically unaware of. So to strengthen the relationship, now in this case, as we know, the mother of the child admitted, of the girl admitted that she is the source of the infection, and but in spite of that, there will be issues like the husband might think that the girl knew her status, but she never confided, and the husband will not believe the girl. Most of the cases, this is a practical truth that the husband keeps thinking that she knew her status, but she hid it before marriage, or she hid it when we were in a relationship. So, what the serodiscordant, as I've started my topic with serodiscordant, but we need to really understand the definition. That is, serodiscordant is one is positive, another is negative, and seroconcordant is both are having the same status. Either the both the couples are negative or both the couples are positive. Now, basically, there's a what are the types of serodiscordance? As we know, either the male or the female is positive. And what are the types of concordance? That is, either both are positive or either both are negative. So, now coming to serodiscordance, behavioral, what are the changes that happen? Like there are biological issues, there are also the behavioral issues. Now, basic thing is, uh, what are the what are the issues that are impacting the serodiscordance. So there will be biological issues like gender, age and early debut, viral load and the disease stage, STIs, male circumcision. Now coming to the issues, what are the like gender? As we all know that gender has a very important role in our patriarchal society. Most of the acceptance is higher on the side of the female part, but when it is the acceptance on the male part, it is usually lower. So what happens is, when a male partner is telling the female partner that I am positive, and possibly you need to take precautions, and you also need to get tested at ICTC. These are the issues that are more acceptable in our pattern of society, more accepted by the weaker section of the society, that is physically weaker, that is the female. But when it comes to the male acceptance, we are still sorry to say that in only few cases we find that the male acceptance is good, because there is a male dominance in our society, and also because the males are the earning member of the family, there is a gender dominance acting there. So gender affects a lot about the discordance. And as we know that the males are usually moving out of the cities uh, for their work, and so they often are engaging themselves into risky behavior, like they have multiple partners at multiple points of residence. So there are chances of them picking up the disease much more than the female counterpart, who usually we come across cases are staying in their remote villages, and they are just getting the infection from their husbands. Age and early debut, how does it affect the discordance? Like in our these new generation, as we see that there is a very early exposure to sexual uh, intimacy, and the age is literally decreasing day by day. Nowadays adolescents are usually engaged in sexual practices, and the problem is basic: they do not know what are the pros and the cons, what are the precautions that have to be taken. They have literally no knowledge about HIV or STIs, so they are more prone to infections. Now, viral load and the disease stage, how does it affect the serodiscordance? The viral load, as we know, that if it is suppressed, and we know by now that undetectable viral load is all over, like it has been practiced all over the globe, that it undetectable is equal to untransmissible, that is U is equal to U. So the disease stage, the viral suppressed viral load is very important, because the more suppressed a client, the lesser the chances of transmission to his spouse or his partner, whoever it is. Now, STIs also play a very important role in the discordance, because sometimes often we come to hear that condom is only for preventing childbirth, controlling a family size, but no, the STIs, like, they are a provoking factor for the other HIV and the hepatitis B infections, because in STIs we usually have ulcers which are gaping mucosal gaps, which allow the entry of the viruses into the system. So the STIs are also important. And in serodiscordant, it's important that a condom is used just not for the sake of child prevention, birth prevention or conception prevention. STI component is very important for preventing the like condoms are very important, sorry, for preventing the STI transmission to the negative partner. And the male circumcision, we all know by now that in a group of population, we have the male circumcision is practiced regularly. With We have our children, they are male circumcised, and it has been seen with a good number of validated studies that because of the prepucial absence of the prepucial skin, there are lesser chances of transmission of HIV. What happens is that under the prepucial skin there are Langerhans cells, and these Langerhans cells are basically, they are the dendritic cells. These are the acceptors of the HIV virus. So the virus does not get the host to harbor themselves, and so the circumcision has been seen to to minimize or decrease the chances of HIV transmission. Now, serodiscordance in a behavioral aspect, as we know, as I spoke, sexual exposures, multiple partners, sexual exposure at a tender age, without knowing the pros and the cons, without knowing the precautions that have to be taken, are a very vital the event which leads to one partner being positive. Condom use is very important, as I said. Condom use does not even, just limit the childbirth, it also limits HIV, hepatitis C, B, and the STI infections. Other sexual partners, it's very important, like this trust and honesty is a very important issue when it comes to a serodiscordant couple, because if you have multiple partners, you are always inviting or harboring the other infections. So you, at the end of the day, it's very important that I am honest with my partner in not transmitting any other infection. And marriage at an tender age is also an important criteria, because often at a tender age, if there is a couple who is married at a very young age, they really don't take precautions about the condoms and all, and they feel that why should I be taking a condom because we are married, and I can always have free sex with my wife. So the need for condom, the awareness, this is also very important. Now, coming to the usually what happens is the challenges of a discordant relationship is trust versus dishonesty, stigma is there, the risk of HIV transmission, testing the partner, consequences of disclosure, disclosure to other partners, sexual intimacy, and pregnancy. As I said, there is a big issue of trust and dishonesty. As in the case study I discussed here, the mother of the girl admitted that she was positive and she never tested the child. But often we confront cases where the wife or the husband is positive, and there is a big issue of trust, and this literally hampers the relationship between the husband and the wife. And often we find that they may be living under the same roof, but they literally stop being husband and wife, and they have a very broken relationship, and they hardly engage in sexual practices. So the trust is very important. And dishonesty, as I said, having multiple partners, carrying infection from multiple partners, and transmitting into the negative spouse is a really difficult situation. Stigma is important. Whenever a serodiscordant couple comes to the counselor, it's very important that the counselor counsels him or her, like to eliminate stigma. HIV word is a trauma to most of our patients. So, when the serodiscordant couple, one partner goes to the other to disclose his status, it's very difficult to disclose the status because the name itself carries a stigma. So, the counseling has to be done to eliminate stigma as far as possible. Risk of HIV transmission has to be explained to the partners. This is very important for a relationship to be a healthy relationship to continue. And as we repeatedly explain to our patients, the HIV transmission does not happen with the normal physiological fluids of our body, not by tears, not by nasal fluid, not by our saliva, neither by urine or feces. Only the transmission is there through the sperms or the vaginal fluid. So this is very important, or by blood transfusion. So, and sometimes they are worried about they are sweating. Patients are worried about mosquitoes in the same room. So they have to be counseled. They have to be assured that HIV transmission does not happen with the normal physiological fluids except the sexual fluids. Okay. So this confidence has to be like, otherwise what will happen is the spouses will be having a very broken relationship, and the counselors needs to be very confident when we are explaining these issues. Testing the partner is important. As I said, you have to bring your partner. When I am positive, I have to coax my partner to get him or her tested. Otherwise, the chain will continue, and I might be transmitting the infection to him unknowingly. That also needs to be prevented. And the consequences of disclosure, often we see that when, as I said, that when a man is positive and the lady of the house, the disclosure issue is there, the acceptance is slightly more, because we know that it's a basically patriarchal system of society, and most of the women are financially dependent on their husbands, and the acceptability is more with the women when she is the negative partner. But the acceptability of the man in the house is lesser when the woman is the positive partner. And so the disclosure has to be done in a very sensitive way. Uh, Whenever there is a positive client at our center, we have to encourage him to bring the spouse to for testing. If he feels that I'm too scared to disclose it to my wife, or if she feels that I'm too scared to disclose it to my husband, they can be encouraged to bring the wife or the husband to the counselor, and the disclosure can be done in front of the counselor, so that whatever the reactions, whatever the stigma, and whatever the information that is needed is proper and is rightfully shared. And the sexual intimacy is very important. Like, as I said, if I am not counseling properly about the stigma, if I'm not counseling about the ways the HIV is not transmitted, if I'm not counseling about U is equal to U, then what happens is the intimacy between the partners is often lost. Even if they are living a relationship of husband and wife, often the physical intimacy is lost. And the pregnancy has to be like assisted. There we have to counsel our young couples about how to move ahead with the pregnancy. There are options like prep are there. There are options like other sperm washing and techniques. Everything has to be discussed in detail. But at the end of the day, I have to tell my patient that if you are taking your ART medicine on time, and if you have a suppressed viral load, you literally have no chances of transmitting your virus to the negative partner. Now, coming to the issues, basically, what are the questions like we confront when we see that the couples are not using condoms? When we ask if you are not planning for a baby at this point of time, why don't you use condoms? So the frequent answers are, we have been having sex so far without condoms and HIV has not been transmitted. Some will tell you, we want to have a child, so we are not using a condom. Some will tell you, culturally marriage is based on trust, and so people do not tend to use condoms. And the use of alcohol is one deterring factor where most of the male partners forget to use a condom. So here the issue is, why do they fail to use condoms? Because they feel that the HIV is not being transmitted. That is true. Basically, HIV will not be transmitted if the mucosas are intact, if there are no cuts or abrasions or ulcers, if the positive partner is taking his or her ART with proper adherence and has a suppressed viral load. These are the pro situations, that are good situations, that are not transmitting the HIV. But suppose my partner has stopped ART for any reason, or the partner is taking his or her ART but has severe diarrhea or fever, whatever reason or vomiting, any acute gastroenteritis, whatever issues have led to the fall in the therapeutic blood level of the drug. So in these cases, the HIV may be transmitted. That is the counseling we have to do. If we want to have this, if the couple tells you that we want to have a child, sure. If you want to have a child, you may be having sex without a condom, but for that also, you need to know the fertility calendar. And that needs to be counseled to the partners. Because if you are having an exposure which will not lead to childbirth, that is unwanted exposure. Okay, so the exposure should be such that it falls within the ovulatory cycle, the fertility calendar, and the fertility calendar has to be explained to the female client. And you can ask the client to maintain a small calendar with her menstrual cycle. And the counseling needs to be done, that which are the dates where you will be fertile and you have the highest chances of conception. And the phases or the days where you do not have a chance of conception, please avoid unwanted exposures. And again, coming to the some young couples often tell that marriage is based on trust, and so we do not use condoms. That is also very true. If I am on drugs and I am on ART, and I'm properly taking my ART and it is suppressed, I don't use condoms. That is also true, but you also need to make that person understand that there may be gaps in your therapeutic blood level, and there are chances that STIs are there. And why not use a condom when you have the chances of limiting so many diseases? And use of alcohol, like nothing to question about, because whenever a patient, a client is under the effect of alcohol, they forget to use a condom. Now, why couples fail to use condoms? We are continuing. We don't have HIV. Use of condom reduces the sexual pleasure. Relationship factors. I am not sick, so it does not matter. So these are all, I have addressed these basic things. Is we have to teach them that it's not just about birth control. It's about HIV. It's about STI control. Relationship factor, yeah, trust is good. Single partner, staying faithful to my partner is good, but at the same time, condom is use is also essential. Now, the use of condom reduces sexual pleasure. Now, there are always, you have the pros and cons of any method you use. Okay, so your sexual pleasure might be reduced to 20%, but your chances of infection also go down by 50%. That's how we need to do our counseling. And this is a very common answer by all our ART patients. We know I am not sick, so it does not matter. So this is also, the knowledge has to be imparted that uh, how does it matter is very important. Your HIV, okay, you are fine taking your ART medicines, but there may be a time that the medicines develop some amount of resistance. There may be a time that you could not take your ART properly, your adherence faltered. So these are the times where you will not feel sick, but your virus will go high in your blood and it will be transmitted. So sickness is nothing, it is not a feature that happens usually after missing 5 pills. That's very important, that like we really need to let our patients know this. Often we encounter high viral loads and the patients are telling us, I am not sick, so it is not really hampering my lifestyle. Why are you worried? No, the basic reason is, the explanation is, you will not be falling sick within the next 6 months. The probability of falling sick is usually beyond 12 months or beyond sometimes 18 months. So you will not be sick tomorrow or day after, but your viral load will be high and you will not be knowing it. So to reduce the chances of HIV transmission to your negative partner, you really need to use a condom. Now, counselor's role in couple counseling. So this is entangled thoughts, bizarre thoughts, which need to be rationalized in the couple's minds. They usually come to us, they have a lot of questions, like that is the reason we request our counselors to talk with the clients in a confidential mode, in a one is to one situation, in a closed space, so that the clients are confident and they feel secure to ask whatever questions they have. And it's the role of a good counselor, be it a counselor at the ART center or a staff nurse or the doctor, to really detangle these thoughts and help our patients uh, adhere well and plan a family. Now, the basic core skills of counseling are listening, showing empathy, being non judgmental, being genuine. And four things a counselor needs to listen is their experiences, what do they see as happening to them, their behaviors, what do they do or fail to do, their sentiments, what are their feelings, and their point of view. So, the core skills of counseling are basically four. You have to be a very good listener if you are a good counselor. And listening is not only active listening, it's also a passive listening. What do we mean by passive listening? Basically, there are words which are spoken by the client, and there are words which are not spoken. The attitude of the patient, the way, the posture in which he or she is sitting, his anxiousness, his eye contact, his stress level, or all these are the non-verbatim approaches of assessing a patient's status. So these are the senses. You have to use your senses. So a counselor has to be a good listener, has to have empathy. There's a difference, difference between sympathy and empathy. Sympathy is when I really am very soft towards an incident that has happened to a client. But an empathy is I put myself into his shoes to see what difficulty he has with his present life. And empathy is very important. Like when a HIV status has been disclosed to a client, and he or she undergoes a lot of traumatic thoughts. There is an issue of declaration to spouse. There is an issue of declaration to the family other members. There are children, and the acceptability issues are there. There are issues about the job. His financial stress is also there. They are really worried about the job place being disclosed, the status being disclosed at their job place. So empathy is very important. There are multiple issues which can be really addressed when you have good empathy towards your HIV positive client. Being non judgmental is very important. So, non judgmental is I will not be superimposing my beliefs and my value systems with the value systems of the client. So, often we encounter that, oh, you have HIV, you went to Mumbai, you were a migrant worker, so you are not a good guy. But that is a very, very wrong approach to see our patients. You cannot be non judgmental. The situations in which they were brought up, his financial issues, his social issues are totally different from the issues of the counselor or the doctor or the staff nurse at the ART center. So it's difficult. It's really difficult to place oneself in that financial social structure where my patient is today, and I cannot superimpose my value systems, my beliefs, and my thoughts on those to his or her. Okay, being genuine and real also helps to strengthen the relationship. Now, what do we need to listen to? The experiences, the behaviors, their sentiments, and their points of view. Counselors really need to be very, very good listeners. And please don't turn your backs to the patients when they are talking to you. And eye contact is very important. We insist that all counselors arrange for a sitting stool in front of their table, and when they are talking with the patients, they at least make the patient sit at comfortably before they start talking. If you do not place your patient in a comfort zone, you really cannot expect your patient to disclose his issues with you. He will not be discussing it with you. Now, coming to the what do we need to remember? It is important to assess what is the meaning of HIV positive status to the couple, what are the major emotions of each partner, assess their relationship status, assess other important issues, example, family support. The thorough assessment will help in better counseling. Counselors' confidence and positive approach help the couples. Counseling skills like empathy, active listening, reflection, paraphrasing, summarizing, non judgmental attitude, and unconditional positive regard should be practiced consciously while counseling the couples. These are psychology terms basically. So, coming to them one by one. Empathy is very important. These are all the skills that a counselor, a good one, should be having. What is empathy? I am sitting on the other side of the table, or I am placing myself in the shoes of the patient. So I start thinking like him. I will think about my family issues, my serodiscordant status, my disclosures problems, my financial problems. I will think like him, and that is exactly what is empathy. Now, coming to active listening, As I said, active listening in counseling psychology is a crucial technique where therapists fully engage with their clients' verbal and non-verbal messages. So you have to understand their emotions and concerns. And active listening basically is you have to pay very close attention, and you can really understand his body language, his way of looking at you. These are the non-verbal cues. The way he's sitting, whether he's sitting at the end of the chair, whether he's nervous or not, whether he's anxious or not, whether she's too silent and mum or not. Okay, so these are the non-verbal cues which are helping you to understand the patient, understand his or her present relationship status. Now, coming to the reflection, what is reflection in psychology? Reflection is basically where the counselor mirrors back to the client their thoughts, feelings, or experiences. So, to deepen the understanding, how much I have understood what she is telling me, to help her understand that, I repeat what she said with small paraphrases. Okay. So if she has told me that she is very scared to tell her, disclose her status to her spouse and to her in laws. So what I do is I summarize what she has said and I repeat that. And that's called a reflection. I deepen the understanding by repeating what she has said. That's reflection. And now, what is paraphrasing? It's very close to reflection. It's basically summarizing whatever the client has told the counselor. And basically, you don't repeat what she said, but you rephrase it. Okay. So, I tell it some other language and some using some other phrases or words, but the I make her understand that, okay, this is what you have told me. I have understood it. Okay. And summarizing is the same thing. After a long story, you summarize the points and tell her, so this is what you really want me to understand. Non-judgmental. Non-judgmental is very, very important because in what our approach to our ART patients is, I am sorry to say, very much judgmental, and it's tinted with our own ideas and thoughts about social structures. What we usually do is we keep criticizing their way of life, we condemn them for having multiple partners, we assume that the patients are having multiple partners, we keep on telling that your feelings, your thoughts of multiple exposure are not right. Yes, it is important to counsel my patient that you really need to be honest with your partner. It's unsafe to stay with the multiple partners. But if my client is a male who has a sexual relationship with a male, she is a lesbian who has a girlfriend as her partner, or she is from the other non-straight group of social structure, then often we are very, very judgmental and we keep on criticizing their ways of life. But we have to restrict that, and basically, like, it's a way of trust. And if you are judgmental, you can never expect the client to understand you, and you can never expect your client to disclose his or her personal issues with you. So counseling has to have empathy, there has to be active listening, reflection, paraphrasing, summarizing, non judgmental attitude, and unconditional positive regard should be practiced. So, there has to be a positive regard, that is, a mutual respect has to be there. You have acquired HIV does not mean that you're a bad person, does not mean that whatever you have been doing is very bad culturally, does not mean that you are not fit to be a normal person again. These are the things that we really need to avoid when counseling. Now, coming to the four primary conversations in couple counseling, it's pretty easy here. Like what we do is we sit with the first partner, who is a positive partner first. Then we sit with the negative partner once, and the best part is sitting with both the partners. at one point of time. You can also, as a part of counseling, tell the partners to go out, take some time, half an hour, and come back with all their questions, whatever queries they have. And good counseling always is when you have really addressed the queries they have in their mind. Now, the couple counseling techniques listen to both the partners separately and together, understand their thoughts, emotions, and point of view, observe their communication pattern and feelings towards each other, problem solving and solution focused approach, home assignments, activities for improvement in communication and understanding each other, joint activities as a couple, unplug the devices and give more quality time to each other, focus on the present, future, and not on the past. So, uh, unplug the devices, as we all know that we are always having a mobile or a bluetooth in our ears. You have to first, the counselor has to be very attentive with the clients, and in the second phase the partners have to be very attentive, and they have to ask all their queries. They have to disclose that whatever stigma, whatever discrimination thoughts I had need to be really rationalized. And assignments can be given, activities can be given, so that they start maintaining their calendars, like fertility calendars can be maintained by them. They can maintain calendars like a diet plan or an exercise plan. They have, like, you have to have more involvement with the partners. Now, couple counseling techniques, they normalize the feelings, reactions, and experiences, effectively use silence when remaining calm. When when you find that the clients are, like, literally they are having a very stressful relationship, and they are, like, they are not looking at each other, they are not happy with each other, and the counselor has to keep calm, and they have to still be supportive, focus on the present and the future. The basic thing is, often we start digging into the past, so that has to be stopped at any cost. Our counseling will be, see, whatever has happened in the past is past. You have to look into the future, and you have to look at what is present today. There are very, very efficacious ART medicines out there. Even you, if you were in the Western world, you will be getting the same quality, good medications from in India also. Often we keep thinking that we are a developing country, might be like I am being given the medicines which are not exactly that effective as the Western world. But assure your patient you are given the best of ART, you are given the best of follow up. ART and the viral loads and the blood test will be done. We are there to support you. But what you need to do is you have to stop avoiding thinking about the past. Okay, express confidence in the couple's ability to deal with the issues. When your couple has dealt with the issues, be congratulate them, like reward them with your remarks like, well, I'm very happy that you have really moved ahead in your life, and reframe questions that are blaming or hostile. That's also very, very important. And overall empathy is the last keyword. Now, coming to exploring the sex life of discordant couples, like, you also have to ask these questions, and sometimes we refrain from asking questions about sex. We think that, oh, my space is not enough, this is too overcrowded. Please keep some time from your daily routine for the discordant couples. Take them to a single room, preferably a room where there are no other listeners except the counselor or the doctor, in this case, whoever is there. Talk to them about sex, how often they have sex. Talk to them about unprotected sex, about the benefits of protected sex. Okay, ask them how frequently they have intimacy, whether the partners are dependent on alcohol or not. These are very important issues you need to explore. Now, coming to the disclosure of the HIV positive status to the partner, often we see, as I said, that it is very important, and it's a very critical part when one client is positive and newly positive, and we ask our patients to bring their spouses for testing. And it's a tough time for them because they have to disclose their status at home. There will be issues of trust, and there will be issues of relationship being on the edges. Now, what we can give support is, we can, if the patient We will always encourage that the patient discloses his status to his spouse. But if he is shaky about it, is unnerved about it, then we, as a counselors or the ART physicians, we can ask them to bring their spouses to us, and the disclosure can be done in front of the ART staff. But remember that the disclosure has to come from the positive client only. The ART staff is by no means in charge of the disclosure. The responsibility does not lie with the ART staff. There are the questions about this. Often we encounter that ART staff should be disclosing. No, the client will be encouraged about disclosing it, and you will always encourage your client to bring his or her spouse. But if you feel that at any point of time that you can ask the client to literally bring the spouse, you can apply a little bit of verbal forcing that you have to bring your wife, we need to talk to her, but the disclosure has to be done by the client himself. The counselor needs to explain that to the client why disclosure has to be done. If the client agrees to the disclosure, the counselor needs to be supportive. Counselor should ask how the client is going to do that and give useful tips. You can always tell how to disclose about it, how to bring about the topic, and like if the negative partner is shocked or in a trauma, how to deal with it. Okay, we can give support in that. The client is anxious about abuse or eviction from the house. The counselor needs to, to support and empower the client about the different ways of dealing with the situation. As per the HIV Act, we know that it's if it is a female counterpart, and if she is threatened by abuse or by, like, she is threatened that she will be evicted from the house, then there are cases that the counselor might take up the role of the disclosure, but this is a very atypical or a rare case. Even when the client is not willing to disclose the status, the counselor needs to remain supportive of the client. If he is not willing to disclose such a status, does not mean that I will stop his ART and I will be scolding him day in and day out. I still need to be supportive. I have to understand that he is scared or anxious because it will hamper his family life. And I have to continue with my counseling and my supportive attitude. So here comes how to reduce the risk. Non-penetrative sexual practices reduce risk. Termination of a relationship doesn't help in reducing risk. I think it leads to more of an adherence gap. ART adherence is the primary important thing that needs to be maintained and reduces the risk of transmission. U is equal to U, as we all know. And the treatment of the STIs is very important because mucosa has to be intact. If the mucosas are intact with the intact cell line barrier, it will help to prevent the infections. And but about this termination of relationship, it is by no mean the core approach to reduce risk. On the contrary, we see that a broken marriage, somebody who has been evicted from his house, not able to stay with his family and children, that does not help. So assurance of both the partners is also very important, that okay, your husband is positive, whatever source he has got his infection, and that is not transmitted through the normal physiological body fluids. You can stay with him. Okay, if you do not trust him anymore, you might not be having an active sexual life, but that please let him stay with you. Let him continue a normal, at least outer uh, exterior family look should be normal, so that the husband can continue with his normal social life. Now, if he's planning a baby, or not planning a baby, there should be family planning is also very important. And now coming to the harm reduction for pregnancy, this is important. Like when a male is positive, if they can afford, they can go for sperm washing, they can go for intrauterine insemination. That is, the semen is collected in a test tube and it is injected into the woman's cervix. And if it is a inexpensive modes have to be adopted, then we rule out STIs, and then we go delay until the viral load is controlled. So U is equal to U is practiced. If the female is positive, artificial insemination can be done. It can also always be done by the couple themselves. For artificial insemination, you really don't need to go for clinics. You can always teach your client, the male partner can be taught how to extract his semen and inject it into his wife. And that's very easy. Intracytoplasmic sperm injection, it's a difficult IVF procedure, and that is really expensive and not available everywhere. So we have to try for better viral load control, good adherence of the patient, good treatment of STIs, and artificial insemination. That's the key process. And sperm washing can be done if the couple is eager to go for it. And limiting the time of unprotected sexual intercourse, as I said, the fertility calendar of the woman needs to be seen. The couple has to maintain a calendar with the day one of the menstrual cycle as the first day of the fertility calendar. And the unwanted exposures during the non-ovulatory phases need to be avoided. Now, coming to the fertility counseling for harm reduction, risk to the unborn child, mother, partner. Basically, we have to counsel to some extent about the child, but it shouldn't be scaring him off. Okay. So the counseling should not be like you are positive, your child will be positive. No, please do not counsel in such a manner. Risk reduction options should be given. The options have to be placed in front of him. What are the options that are available? As I said in my previous slide, these are the options that are available. Chances of lowering fertility, they are there because you are on ART, your body might react some way, your sperm count may go down. You have to counsel about these issues. Wait until the infected partner is on ART with undetectable viral load. That is the key important aspect nowadays, that just wait for some time. Do not go for family planning now until and unless your partner is negative virologically, like not exactly negative, is undetectable. You wait for that time and you go for your family planning. Genital examination is important, as I said. Scars and ulcers cannot be there. And benefits of sharing plans with the provider will help them to plan their fertility calendars. Now, the scenarios for practice: a negative husband of a positive woman says to the counselor, "When do you think my wife got infected by HIV?" How does the counselor cope with such questions? See, basically, the client is confused, upset, and he feels betrayed. The counselor's response will be, you have to listen to the client very calm and attentively. You have to normalize the feelings. He will be talking very anxiously because he's also not happy to play such a question. And now the approach will be, think about the future. That is the main approach. We have to stabilize your wife's health. We will see to it that your wife is on the best of medicine. We will see that you are checked every 6 months. Our endeavor will be to have a negative child. We will give you a very happy family life. We will tell you about the protections that need to be taken, and we also have the for long approach of giving you a pre-exposure drug, and the condom has to be used to prevent unwanted exposures. Okay, so the approach will be uh, an approach of empathy. We will not be shouting at the client that how he could place at the spouse of the client, how he could place such a question, or not at all. There will be questions like this, but the main emphasis will be on the future days. Uh, in spite of the positivity of your wife, you can have a normal life. You will not be having the infection. Your wife will live a long life of around another 30 to 40 years if she's on her ART properly. You have the chances, a good chance of having a negative child, and you will have a happy family if you can reduce your stress and anxiety. And please do not think about the past. That is the approach. Now, the second is a positive husband of a negative woman says to the counselor, I don't want to use a condom because I do not feel I am doing a sex if I wear it. We are a married couple. We should not be using it. Why should I use it? Why me? Why I got this infection? That is a very important, very common question. This means I won't be able to enjoy sex without a condom. Why the barrier between us? It is just impossible to use a condom for the entire life. So the emotions in this positive man is grief, sadness, frustrations, disappointment, and anger. Okay, why I have this infection? Why why it was me? Okay, I'm not able to enjoy sex without condoms. So again, here talk calmly, attentively. Discuss that basically things are difficult when you are newly detected, you have a new infection, you are started on your ART, you might not be feeling well, but these days will pass. Okay, discuss what is the long term goal in your life. You need to really have a happy family. You need to keep your spouse negative. That is your ultimate goal. If you can keep your spouse negative, you will be having negative children. Okay, and there is nothing called a word like difficult. Okay, it is difficult to have sex without condom, but it's even more difficult to have a life where both the partners are positive. Okay, if both of you are falling sick at any point of time, who will look after whom? So there is nothing called difficult. And keep small targets. Use a condom for a month. See that you will be acquiring that habit. Now that's the end of my discussion. Basically, the treatment guidelines for HIV, we have an app, the National Guidelines for HIV Care and Treatment 2021. It was published by NACO under the Ministry of Health and Family Welfare, and the mobile app is now available. We can download it, and there are resources, and we have the calculators, and not only the ART physicians, the counselors can also look into these, and they are really informative. And that's the end of my discussion. Hopefully, it was explainable and I was understandable. And thank
Thank
you.
you so much, ma'am, for the wonderful session. Ma'am, can you go to the previous slide, please?
Yes,
I just need to take a screenshot, ma'am.
sure.
Done, ma'am. Thank
Okay.
you, ma'am. Any questions from the participants? Please feel free to unmute and ask questions. You can also put your questions in the chat box.
Good afternoon, madam.
Yes,
Good
sir.
afternoon.
Myself, Dr. B.N. Tripathi from Bhubaneswar ART Center, Odisha.
Yes, sir. Yes, sir. Tell me.
Ma'am, very nice presentation. And
Thank you, sir.
there are so many questions lurking in my mind since I am my 11 years of working over here
Yes,
on
sir.
this subject.
Okay.
And fortunately, this was discussed today. Recently, what happened? One of my clients, discordant couple, the husband is positive and the wife is negative.
Mhm.
So they have got already a female child of 5 years of age, uh, and they want another issue,
Okay.
pregnancy, and they have visited the IVF center. I do not know, and
Mhm.
the IVF doctor has advised them to come up with HIV/AIDS opinion from ART center.
The husband is
But
positive here.
but exactly what they wanted to know from me, it was not mentioned there. But when I examined the records of the client, he was virally suppressed.
Here, the male partner is positive, sir.
Male partner was positive
Okay.
and the female partner was negative. And,
Sir, I'm also working for several, so more than a decade. Our experience is IVF centers usually do not cater to positive patients, sir, because they have to centrifuge the semen in their centrifuge machine. And IVF centers do not want to accept sperm samples which are from positive patients, sir. uh, they will uh, they will not be telling no on pen and paper, but usually they decline to do artificial insemination. But the best part is, sir, what you can do for these patients is you need to counsel your male partner that if he's u is equal to u is there, sir. If he is
Yes,
suppressed, and if needed, you can do a viral load for him every 6 months, sir. Not 1 year. Every 6 months, you can do a viral load, and you can also ask him to go tested for any ulcer or any other STI infection. And you can assure your woman, sir, that the lady of the house, that you will not be getting the infection. And that's the best way, sir. And what usually I do is we tell the lady that this is your fertility calendar. So starting from the 8th day of her mens, she is usually fertile, her ovum is fertile. So you have to go for unprotected sexual intercourse from the 8th day to the 15th day of your cycle, sir.
okay, okay,
Okay, so it is 8, 9, 10, 11, 12, 13, 14, 15. So a woman stays fertile only for these 8 days of the month.
okay,
And you won't believe basically what the gynecologists do is just they counsel about the fertility calendar. That's all they do. So
okay,
going for a unprotected sexual exposure beyond 15th day does not help, because by that time the ovum is no more there. And going for a fertility exposure beyond before 8th day also doesn't help, sir. So
okay,
what you tell is to tell them to maintain a small diary where the woman notes down the day one of her periods every month. And from the 8th day onward, they go for unprotected sexual intercourse. And then after the 15th day, they will stop, sir. Okay. They can try for 3 consecutive months. And if they are pregnant, it's good and it's well and good. But if they are not pregnant, then again, you have to go for a sperm count and other gynecological tests for the lady.
okay.
But sir, frankly speaking, the IVF centers, I'm sorry to say, even like I have seen patients going to several cities all over India, spending lakhs of rupees, but the IVF centers do not do the artificial insemination for them.
Now, in this case, I advised that particular client who has got a successful child.
Yes, sir.
He told that you are quite fertile and you are also virally suppressed. So
Yes, sir.
this formula you also explained to him.
Yes, sir.
And I advise them that you can go for unprotected sex to get a.
Yes, no issues. But
And
you have to limit
why he
the
choose to go to-
days of exposure, sir. That's very
Of
important.
course. Why he choose to go to, still he was not able to tell me why he prefers IVF. And IVF people, the IVF doctors, she appeared to be confused. What exactly say information, what kind of
Now,
information?
he can go for a sperm wash, sir. That's effective. But the same thing here again, sir, sperm washing involves centrifuging the sample in the centrifuge machine. And I have spoken to several centers in my town, and they gave me the feedback, the IVF centers, that if other clients come to know that I am centrifuging one positive sample, other clients will run away from my center. And
Oh,
this is what my experience. So it's best to guide about U is equal to U, sir. And the next best thing is you guide about the 8 days of fertility in a woman's calendar. And the last thing is, sir, if because it's a day of internet, and people often read themselves about the prep, sir.
okay.
If you want, you can also give prep to the lady if they are very much anxious and eager to go for prep.
No, that part is there, but that I know. But the thing is, in this case, one question arose in my mind from that issue. That question is uh, whether IVF carries it after washing the sperm, if that is used for fertilization. Is there any risk on that?
No, after sperm wash, the virus is no more there.
Similarly, in this case, U is equal to U formula also applies.
This also applies, and also, sir, sperm wash centrifuges the sperm, no? And so at those spinning, if you remember the centrifuge machines, after that spinning, the viruses are lost basically.
Acha, acha.
It's basically sterile from the point of virus.
Acha, acha.
So artificial like sperm wash is enough. Okay, sir.
Okay, okay.
Sperm wash and that sperm just injected into the woman's cervix is enough.
And if the
IVF is something that is that is separate. IVF is you're taking the ovum from the woman, you're taking the sperm from the man, and you are basically preparing a zygote or a morula in the lab.
yes.
Okay, sir.
Yes,
So
sir.
this morula or the zygote you are preparing in the lab, and again you are injecting that into the woman's uterus. So that is an expensive thing, sir. That's not essential in this case.
Definitely.
Okay, sir.
My question is, suppose the client is not virally suppressed, not
Yes.
suppressed. So if he chooses to go to for IVF, and IVF center is willing to do IVF, apply the technology on him for a pregnancy,
Then the sperm wash will be enough.
spermas will solve the problem.
Yes, yes.
It will make the sperm free of virus.
Sterile of virus, yeah.
Okay, okay, okay. Thank you.
Okay.
Thank you very much.
Okay.
Okay.
Any more questions? Ma'am, we'll keep taking the questions. We'll just run the feedback form
Sure.
till then. Kiran sir, can we have the feedback form? Thank you. Requesting participants to please attempt the feedback poll. The questions are visible on your screen. There are 5 questions in all. Please scroll through the questions and click on the answer of your choice. Any more questions? Participants can please unmute and ask questions, or they can put them in the chat box. Requesting all the participants to please attempt the feedback poll. Thank you so much, ma'am, for the wonderful detailed session.
Thank you,
Ma'am, I
Sweta.
won't keep you waiting.
Okay.
I'll just finish the feedback poll and then I'll conclude the session.
Just a word of reminder for everyone that even if you have questions later on, you can always get back to us at coestm1@gmail.com with all your queries. We will answer them attentively. Okay.
Thank you
Thank you,
so much, ma'am.
Sweta.
Thank you, ma'am. Requesting all the participants to please attempt the feedback poll. Only 15 of 53 participants have attempted so far. We'll wait for another 2 minutes for the feedback poll. Kiran sir, we can end the feedback poll now. Thank you everyone for your active participation and patient listening. We'll conclude the session now.